Again with legendary Dr. Lee Cowden, considered Lyme expert by those who are smart enough to know that. Okay, we still have a ton of questions and we've been going an hour, so we are going to speed through this. You talked about the 23andMe already having value because it's only $99. It's slightly limited, but for 99 bucks, it's still a pretty good test. Just quickly, from a Thrive perspective, what I'm hoping I can come to consensus on is that within the first $5,000 that people spend, they do a 23andMe for 99 bucks. They send it through geneticgenie.org for 25 bucks. They get their big printout. They check out a highlighter, and they highlight it, and then they just pick 2 things to add in trying with a therapeutic trial, titrated therapeutic trial, and 2 things that they try to avoid, and then they move on to something else. But what are your thoughts on that and MTHFR?
Yeah, well, 23andMe didn't find all the different genetic defects that are actually creating problems for that person, but it finds some of them. And if you address the ones that it finds, sometimes you can get a significant improvement in the patient's condition. So if the MTHFR is defective and you give the right active form of folate or the right form of B12, then that might significantly improve the person's condition because they get to where they can methylate the DNA of viruses and prevent them from replicating. They get to a place where they can detoxify more efficiently. They get to a place where they can form proper levels of neurotransmitters more efficiently and so on. So many good things come out of that.
And in the world of parasites, a lot of times they really try to avoid all this stuff to kill the parasites because they're determined to believe that the parasites eat everything first, which there is some truth to. But my belief is, bottom line is, you are not going to completely starve these parasites because you're going to continue to eat. So the healthier you eat and the stuff that you keep in that has helped you, as long as you do it sublingual or topical or rectally after you've had a nice good clean out with an enema, the odds are higher that you're feeding yourself and not the parasite. Would you agree?
Yeah, you need to be doing the best you can to nourish yourself. The worms that live in the gut lumen are going to get first choice. They're going to get whatever they want first, and then whatever's left over you get.
But if you do it sublingually or topically or rectally post-enema, okay, perfect.
Yeah. So if you do a sublingual drops or sublingual tablet or a topical application, then you can sometimes get nutrients in or bypass their greediness.
Perfect. How important is it to reverse the genetic mutations, and can they be reversed quickly?
How important it is to reverse the DNA problems?
The genetic mutations, and can they be reversed?
Well, you're not reversing them. What you're doing is you're giving precursors and cofactors that make that defective enzyme work more effectively than it would if you didn't do that. And sometimes it's enough to make a difference as far as the outcome of the patient, improving their symptoms, improving their immune function, improving their ability to fight, and improving the ability to recover.
And I want to say something here that Dr. Gordon said to me a long time ago. He was the first one to work with Dr. Yasko. He said, Dana, these aren't even really mutations. Bottom line is we're all one big party of genes that are suboptimally performing. Nobody has optimally performing genes, and the more toxic we are, the greater that epigenetic layer is that's turning on and off different genes. So our goal is to simply lessen the epigenetic force on our genes, and then we do better. And it's that simple.
Yep.
Okay.
That's what Pioneer found with his cats. If you gave the cats a bad diet on the first generation, you could recover them just by giving them a good diet. On the second generation, you could still recover them by giving them a good diet. By the third generation, you could not recover them by just giving them a good diet. So we're now into the third generation in this country of eating junk food diets. So we're getting to where we're going to be less responsive to nutrition.
But it's just harder, but we can still for sure get there. Okay, from Sherry, what is the best way to test babies born to mothers with Lyme? Is it from cord blood? Quickly.
Yeah. If you're gonna try to treat the kids that have been born to a Lyme mom, you can diagnose that at time of birth on cord blood, and if they've got Lyme in the cord blood, they almost certainly have Lyme in their body. You don't have to stick them.
Okay. If the mother can't handle long-term antibiotics while pregnant or breastfeeding, what are some ways, supplement herbs, she can help protect her fetus infant, especially when the mother found out while pregnant about Lyme, heavy metals, and parasites?
Yeah, I've found that a breastfeeding mom can safely take the Cemento for Nutrimetics, and that's usually well tolerated by the baby that breastfeeds and effective against many of the Lyme-related microbes, especially Borrelia. If there's babesia or other things, sometimes you have to find other remedies for that at that point. But treat the things you can treat easily and safely first, and then see what happens.
Okay, are there any tests, especially MTHFR gene mutations or protocols monitoring recommended for babies born to mothers with Lyme in order to heighten the chances of the child being healthy?
Yeah, well, if the child is doing well post birth and thriving, then you don't have to go into all that stuff, even if the mom does have Lyme disease. But if the child has failure to thrive, then you definitely want to look deeper, and you want to look at the MTHFR and the sulfation pathway enzymes, especially because you got to make glutathione in order to detoxify. If you're not making glutathione, then use topical glutathione on the child's skin to get the glutathione levels up to be able to detoxify and get healthier.
And Roy Dittman wrote a book called The Brighton Baby, which is a 400-page encyclopedia on what to do before you have a baby and after you have a baby for them to be healthy, so that should be helpful too. From Sunny, since Lyme is such an epidemic, why hasn't anyone considered a commune model to house the Lyme victims, or a Lyme hospital or a research center to assess so many who suffer? Would the model like this work? I think it would totally work, but it speaks to the problem that in mainstream medicine they don't want to admit that it even exists.
Well, it's a socioeconomic political thing. It's not in the best interest of the pharmaceutical companies for it to happen, and for the insurance companies for it to happen, then the chance of it happening is not very great in this country.
Sorry, the doorbell rang. So, okay, Lee, we're going to do this in turbo time because I'm not going to be able to do this again afterwards, and neither are you. Okay, which ones? Does Borrelia also pass through the breast milk?
Yeah, it does.
Okay, perfect. Yes, it does.
Yeah.
What percentage of pregnancy end due to Lyme disease infection? Who would know, right?
Say that again?
What percentage of pregnancies end due to a Lyme disease infection? You would never know that.
I wouldn't know yet.
Yeah. How do you combat anemia? Is this a direct result of Ehrlichia only, or also Lyme and or more?
No, there's dozens of causes of anemia, and some people assume that it's the Lyme bugs, which in many cases it's not. It's other things.
Okay, suppressing the immune system while pregnant is the body's way to accept the fetus. That is why one feels okay during pregnancy and horrible afterwards. Have you found that to be true also?
Yes, I do find that the Lyme tends to grow up during the pregnancy, and when the delivery finally happens and the hormones go back toward normal, that the moms sometimes feel pretty bad.
Okay, Steve, ask him if he believes that Lyme is a lie, which I think it is. Ticks are not the vector, and the BB bacteria is not the pathogen. Wake up, people. Do you have any opinion on, let's not even worry about that. But you believe that Lyme is real.
It's transmitted by lots of different routes, not
right.
just the tick.
Absolutely. And my belief is that everybody has Lyme. It's not whether or not you have Lyme, it's what your body does with it. Yeah, okay. They're on the ground. Sarah, thanks for all you do. Sunny. Timor Nelson is not for, okay, wait, I believe in you. Okay, then they just got into stuff, which, okay. Boy, this got wasteful, people arguing. He doesn't have a, okay, okay. I think we might be done. I'm trying to make sure. It says, why is Germany so much farther along, but then they decided that it wasn't. Wait. I just want to make sure I'm done with this. So, wow, you people got a little crazy here, if I do say so myself. I'm interested in finding out what people should do if they have started Lyme treatment and then go to a parasite treatment. Should they continue using the Klinghardt co-infection protocol? I'm going to speak to this. We have some moms who somehow finagled their way in to see Dr. Klinghardt and had these fabulous protocols they were doing, and were doing quite well. Then ended up hearing about the Kerry Rivera CD protocol, where they were told to go off everything, did very well for the first month and a half, and then did very poorly. And sure enough, when we test through what they need, the Klinghardt co-infection protocol was exactly what they could have had on board and done really well with. Okay, that was easy. It's hard to treat infections when hormones are in the mix. Tell us the the Klinghardt Pro. Okay, wait. Okay, I think it was asked already. Oh my God. Okay, if I wait, how do you feel about fenbendazole and how do you dose it?
Feel that what?
Fenbendazole. Fenbendazole?
Fenbendazole is probably one of the better tolerated pharmaceuticals for worm parasites, and I use it sometimes whenever the other natural therapies are not sufficient. But it needs to be given usually at the dose higher than what's recommended in the physician desk reference, and cycled on and off for a few times.
Okay, they were actually asking about fenbendazole with an F, not an M, but it's the same class of drug, so it's similar, right?
Yeah. Albendazole, mebendazole, diabendazole, I think is another one that's available in another country. But those are all the same class of drugs, and some of them are better tolerated, some of them more toxic. So you just need to try to pick wisely.
Right. And haven't you found that the bendazole family of drugs themselves are quite safe? It's the response the body has to the high parasite load that's sometimes the problem.
Yeah, it's a big problem. How fast the bugs die, and whether the body can handle the buildup of the carcass load.
And just to be clear, because this was a debate, in the CD protocol in the book by Kerry Rivera, they do 3 full months of parasite protocol with the Calker protocol and the baby bottle CD method, and then they add in what they call chelators. Wouldn't you start with binders from the beginning?
Well, you start the binders before you ever start any parasite treatment.
Exactly.
Do that for at least a week or two before you start.
And that's where, in Klinghardt, that question's already been asked and answered, and he's exactly the same way. Okay, thank you, everybody. That was Dr. Lee Cowden, who, if they want to see you in Texas, where do they go? What website?
They can't usually. They can go to the Academy website to contact us and learn more about what we're doing. And everybody that's listening ought to become at least a free member of the Academy.
What's the website?
It's ACIM Connect, CONNECT.com, ACIMConnect.com.
And they have amazing videos, and they have amazing doctors and great conferences, and Dr. Lee Cowden's their medical director, and he's my Brad Pitt, if you want to know what that means. Okay, thank you so much. We have a summit coming up in July that we will probably follow up with some of these. But thank you, and thrivewith3eyes.com is where all the startup information is. Thanks.